Oromia Health Bureau Orientation on Malaria Laboratory Diagnosis Service Monitoring Presenter Muhammad Abu Samad, November 2024. Monitoring Malaria Laboratory Diagnosis Outlines Laboratory Diagnosis of Malaria Application of Malaria RDT Malaria Lab Diagnosis Supply Malaria Lab Service and its quality monitoring coordination and communication among stakeholders. Malaria lab diagnosis methods. Two methods. 1. Direct diagnosis. 2. Indirect diagnosis. Direct diagnosis is direct demonstration of parasites, whole cell or parasites, nucleic acid or products in the blood, microscopy, molecular. Second, indirect diagnosis means demonstration of patient's immune response to the infection or immune diagnosis RDT. A malaria microscopy diagnosis. Required material and equipment. These are lens paper, lens cleaning solution, immersion oil, binocular microscopy, stained blood film or Giemsa stain, tally, counters, tissue paper, slide box or boxes. Malaria microscopy diagnosis is the gold standard methods for detecting, identifying, and quantifying of malaria parasite in blood sample. Requires trained lab personnel and equipment. Examination made by preparing both stick and thin film on the same slide. Malaria microscopy smear preparation. A. Thick blood film. Thin blood film to detect parasite. To measure parasite density. Very sensitive, detecting as few as a parasites of blood. Thin blood film. Second, thin blood film for species identification and has a sensitivity of 20 parasites per microliters. Malaria microscopy diagnosis. BF staining. Blood film staining. 1. Giemsa stain stock preparation. Ingredients used. 1. Giemsa powder. 2. Absolute methanol. 3. Glycerol for measuring cylinder. Second, Giemsa working solution preparation requires Giemsa stain stock solution, buffer tablets, distilled water, measuring cylinder. Malaria microscopy diagnosis. Blood film staining. Quality control and documentation. Perform a quality control check for every new batch or lot of stock solution prepared before using it as a working solution during Giemsa staining. Before sending it to laboratories for use, weekly based and any time of suspicion. Record the information in the quality control logbook. Blood film staining procedures. 1. Dilute the Giemsa stain stock solution. 1:10. Dilute 1 part of stock solution with 9 part buffered water. And then keep away from direct sunlight. Can be used for 24 hours. Fix the thin film only with methanol. Add Giemsa working solution 1:10 on both thin and thick film and wait for 10 minutes and wash and dry. Malaria parasite detection and species identification is Plasmodium falciparum and Plasmodium vivax imagically when we see. B. Malaria Rapid Diagnostic Test, RDT. The malaria RDT is immunochromatographic technique. Detects plasmodium specific antigens in blood samples using monoclonal antibodies. Impregnated on a nitrocellulose membrane. Specimen type: white blood, serum, or plasma. Malaria RDT testing procedures. 1. Add 5 microliter white bloods. 2. Add 3 drop of assay buffer. 3. Set time 20 equals to 25 up to 35 minutes. Malaria rapid diagnostic test supplies and documents. Required supplies: RDT device, sterile blood lancet, alcohol swab, sample transfer, PPT, buffer, glove, timer, sharp container, biohazard bag, labeling pencil or pen, permanent marker, waste bin. Documents and records: laboratory registration book, laboratory test request and result reporting form, PIN card, stock card, SOP, job aid. Application of malaria RDT. RDTs can be used at community or federal level where microscopy is not available, where no electric power supply. Malaria microscopy diagnosis. Common methods. Malaria diagnostic test, microscopy based. 1. Malaria diagnostic test Malaria microscopy diagnosis or common methods are: malaria diagnostic test. 1. Microscopy based. 2. Rapid diagnostic test. Advantage of malaria diagnostic microscopy based: very accurate and specific. Provide both quantitative and qualitative. That means plasmodium species and quantitative parasite density data. It reveals the stage of malaria infection. Disadvantage of malaria diagnostic test, microscopy based. Requires highly trained personnel. Requires reliable electricity supply. The second one is rapid diagnostic test. Advantage: provide result very quickly. It is inexpensive or cheap. Very easy to use with little training. Disadvantage of RDT: unable to quantify parasite density, cannot differentiate between past and present infection. Mutation in the gene encoding the antigen can affect the result. Malaria lab supply monitoring. PHRRL, prepare GIMSA, stain, stock, solution, and validate its quality and make ready for distribution. Zonal health office or community health office or THO collect the GIMSA stain stock solution from PHRRLS and distribute to their respective health facility. Health facility should monitor malaria lab supplies and require the right quantity at the right time to avoid service interruption. The malaria task forces should also monitor and ensure the availability of malaria lab supplies at all levels. That means for RDT and microscopy. Malaria lab quality assurance. Malaria task force should ensure quality of microscopy used for malaria diagnosis at health facility, quality of GIMSA stain solution at health facility level, IQC. Performance. Appropriate GIMSA reagent bottle used for transportation and storage. RDT verification and storage conditions. That means at store, peripheral, or health post level. Malaria lab quality assurance. Malaria EQA. External quality assurance. Participation, availability of feedback, and the score down results resolved. Facilitate, provide training for RDT tester if needed. The availability of RDT standard operating procedures or job aids. The task force should also monitor the performance of RDT tester, either by checklist or test comparison. Coordination and communication. Laboratory expert should be a member of malaria task forces, MTF, at all levels, zonal, city, town, wherever or health facility. The laboratory expert or malaria task force should monitor malaria laboratory service provision in all health facilities and take consequent corrective action with MTF for any gaps observed. As malaria lab service performance and other related information should be approved and reported to the next level by respective malaria task force. There should be communication and collaboration between different focals, lab or vice versa, FEM, malaria, focal person, logistic. Thank you.